All right. So we have a big injury that happened to a professional wrestler named Cody Rhodes. And they say that his pec was torn off the bone. He still wrestled with this. He still performed, which is, I don't know if that's insane or what, but what do you see, Rain?
Well, there's an incredible amount of bruising. I mean, it's
Yeah.
obvious, but you always want to point out soft tissue damage. And then you see um, the attachment of the arm to the front of the body through the pec, through coracoid brachialis, through many other muscles that we can name. But the pec is a huge part of adduction across the front of the chest, right?
Yeah.
Adduction. So he's going to find other ways to compensate. He's probably going to get really strong in that upper trap. I mean, he's very strong. So he's going to be able to compensate. That's actually why athletes keep going. Like you said, how did he keep going? He probably used his legs more, right? Is it on the, he can get on the floor. Yeah. Because if he can use all his limbs, he can continue to fight. If he has got to be arm dominant, he's going to have to come up with something.
Yeah.
Yeah. But they can reattach it.
Yeah. He already had the surgery, but
Yeah. So
what should he have not performed?
I'm not going to answer that because athletes do things that are amazing.
Yeah.
Honestly, right? Athletes, it's an adrenaline rush. So you could say the same thing about anybody in an experience of just downloading all that adrenaline. You can lift a car, you know, like we hear stories all the time. So he just probably kept going. And then afterwards it hurt a lot.
Yeah. Yeah. Could this have come from posture or, I mean, leading up to
I'd
it?
have to see the injury, like what happened, you know, because if you take any body limb far enough past its range of motion, injury is going to occur. So I'd have to know what happened to him.
Yeah. Well, apparently it happened in the gym.
Interesting. Again,
And
we don't know what he was doing.
yeah, and it's hard to get a good posture shot. Even though he has a shirt off, it's still hard to tell because he's not in posture pose up against a wall.
Right.
But you know,
It
I would
it
have to
definitely
assume that there's,
hurt.
look, people are even making like tribute photos here of him. Look at this.
Hmm.
This is why they go out and perform with injuries, because they go down as legends in their demographic, right?
Yeah, you know, and so much. I mean, I'm not joking, but if you're pumped up on that adrenaline, you don't feel half as much as you do when the gig is over. And he can rehab that. And I'm not saying what he did is great, but I mean, he's a prime athlete. So kind of almost, I mean, look, did he win? It looks like he won. I don't know.
Yeah. Well, he was scripted to win.
But then he would be perfect person to approach to help rebalance because it's going to create an imbalance as he heals that.
Yeah.
You know.
Here's an interesting photo, I think before his surgery. Look at his whole arm.
It's bruised, you know.
Yeah.
Ow. It just, but I mean, it's his sport. You should look at the x-rays of BMX bikers. Like every bone in their body has been broken just from that. I've seen really gruesome things because these guys throw themselves out there. They train for it. They throw themselves out there. There's expectations. He's going to have a top shelf. People put him back together, but he still might be crooked. So what I would do is track him later and then, ooh, what's that one?
Which one?
Go down one more. It's very physical therapy looking. It was like an extension position of his arm. One more.
This
No,
one?
I guess it went away. No, it's okay. There. Not that one.
This one?
No, there was
You,
one under it. Like it was
you
almost
just
like
want to see him naked here.
no, but you can talk about the strong abdominals with the strong back can make injuries happen. So he needs to make sure he has good extension. It looked like
Right.
he was doing some PT with some extension and arm. I mean, he's going to have to rehab the whole shoulder, right? The front, the back, the side, how it connects to the scap. The scap talks to the rib cage. The rib cage is going to talk to the spine. That was the one. It's like, so all of that's going to be affected. He's a
Yeah.
prime athlete. He can overcompensate like crazy versus the weekend athlete who can't lift their arm, if they had that issue.
Right.
So, I mean,
The pec is a big muscle too. I mean,
yeah, it's huge. I think that one's, what's that going to be? Pec, is it all pec? Because there's pec and yeah. And then it twists when it attaches. So that's always an interesting thing, overlapping and twists.
yeah. Yeah,
So
he's
it's
gonna.
old school. Remember, it was this one. I must increase the bust. Maybe not for the boys, but maybe, I don't know. But you can feel the pecs when you do this, or if you watch AGT and watch Terry Crews do his little pec dance. I mean, it's a muscle you can completely train to do what you want. And when it's not connected, you're going to have to, there you go. See, that's your adduction. It's your abduction. So we have exercises we give in posture training, with this movement
Yeah.
score and this movement score. So that muscle group is going to be imperative to abduction, adduction of the arm, of the humerus.
So now the question is, how do we get Cody Rhodes over to the Peace Over Pain Clinic? Because we could help him.
Absolutely. Send him this.
Yeah, right, right.
Mhm. Send
Just
him this.
email it to him. But most athletes, all athletes, would benefit from postural therapy to prevent injuries.
Absolutely. I've got someone I'm working with who is training for an Ironman.
Hmm.
Just and I have nothing to do with the training. I have everything to do. It's just a friend of the family, But I'm just giving her some e-sizes or posture therapy from, our handbook just to help her a little bit. And
Yeah,
she was amazed that she hadn't thought about posture therapy for an athlete. She thought she needed stretching. And I
right.
was like, no, stretching's just you want to rebalance. So we would say the same thing to this professional athlete. You want to rebalance every time so that in between your body is restful, easeful, efficient. And that I love that word, efficient. And most athletes get that. The more efficient you are, the less time you waste training. You get on with it, right? There, that internal rotation, people take that for granted. But most of us are good at that because of computers, and the medial is the internal rotation of the humerus in the joint. That's how you get overly tight pecs. So if there's people out there who can't open their chest, that muscle is contracted and pulling them down and shutting off the rib cage.
Hmm.
So that's another way to talk about the pec. Dysfunction of the pec. It's too tight. You've got really kyphotic posture, too loose, hyperextension. It's kind of your Clark Kent Superman scenario. You need
Right,
to be able to do both
right.
in and out. It's a great muscle to explore. And you can feel it, right? You can put your hand right here and massage a bit. And if it's like, oh, ow, well,
Yeah,
then Some people
yeah.
don't feel anything.
And fun fact of the day,
Fun fact of the day, tell me.
a cow's peck is called brisket.
Oh no, really?
Yeah. All
Oh,
right. Well, hopefully Cody Rhodes,
bye-bye.
hopefully Cody Rhodes or other athletes see
That
this
would be great.
and maybe,
Give
we
us a
can,
testimonial, right? We work with them, they work with us.
right, right.
Brisket. Really?